Good afternoon to you. Well, an organisation called the African Alliance is now lodging a complaint of the Judicial Services Commission against the Chief Justice Mogoeng Mogoeng. Do you remember those comments he made last year about COVID-19 vaccines? The Chief Justice said if there was evil or 666 in vaccines, then Jesus Christ must strike them down. He's been sharply criticised for questioning the efficacy of vaccines. Tian Johnson runs the organisation called the African Alliance. Tian, good afternoon to you. Why have you lodged this complaint against the Chief Justice?
Good afternoon, Stephen. Stephen, we've lodged this complaint against the Chief Justice because he holds an extremely visible and powerful position in this country. And for him to make such pronouncements materially pushes back the work that we've been doing since the onset of this pandemic in South Africa with communities to build their faith and their trust in the safety of vaccines.
There are other complaints that have been lodged against him. Why are you doing this now? I mean, some complaints were lodged, at least one complaint was lodged last year.
Absolutely. One of the things we pride ourselves on is doing a thorough job. And if you look at the affidavits that we've put together, we've done an entire review of the evidence and the literature that supports why his anti-vaxxer, vaccine hesitant remarks will further fuel these harmful messages. So we believe the affidavit is solid, it's well researched, and it has a good chance of passing review and entering into a complaint stage to hold him account for what he says.
Do you want the Judicial Services Commission to actually remove the Chief Justice or merely to rebuke him or chastise him for these comments?
At this stage, we won't preempt what we'd like the Judicial Conduct Committee to do. What we did feel was important is that we needed to go on record as community organizations working on the ground in this country to build faith in science at community level, to hold those in power, because of course it's not just him. We've had several senior politicians and public figures who continuously spout these conspiracy theories, and these theories have no basis in evidence or reality. And so it's important for us to continue this work. This is not just the only case, but there are several cases. And so we will continue to hold people with power, privilege, and platform to account for what they say about vaccines and about the safety of medicines in general.
The Chief Justice himself, I mean, he defended himself last year. He said he has a right to freedom of speech, and on that he must be correct. He says also that if he has a strong view on something, he can express himself. I mean, he's talking about something that's really important. I mean, legally speaking, he is right, isn't he?
He's right in that he has the freedom to express what he needs to express, but he's not Joe Public. He's not a man on the street. This is a man who holds power and influence, and we've seen directly the impact of his words. A simple search on social media will show you the power that his pronouncements have had on communities that are already dealing with vaccine hesitancy. And of course, the irony of this is that as the country's most senior judge, who is in theory supposed to have a clear grasp on the law, he fails to recognize the fact that bodies like the South African Health Regulatory Authority, SAHPRA, have been established as a result of legal frameworks. And these organizations purely exist to ensure that medicines, including vaccines, are safe, they are effective, and they're of high quality. So there's absolutely no context in reality for his comments, no matter how far-fetched. So certainly he has the freedom to express himself, but what he does not have the freedom to do is fuel an already existing tense environment where community organizations, largely unfunded, are working daily to prepare for this huge tsunami of vaccines that are coming into communities. So in effect, he's undermining the investments that we're all making to ensure that we get answers and solutions to COVID-19. And for that, he needs to be accountable.
The Chief Justice is the chair of the Judicial Services Commission. Now, there's a Judicial Conduct Committee which is actually chaired by the Deputy Chief Justice, Raymond Zondo. He's got a pretty full diary at the moment. But you're putting the JSC in a complicated position here, I mean, by lodging a complaint against its chair.
That was something we did reflect on, Stephen. But we do believe in the process, and we have faith in the process, and we are eagerly going to watch in terms of how the Conduct Committee and its actions unfold. This won't be the last time they'll be hearing from us should remedy not be provided. At the very least, we want them to review the complaint. But we need to ensure that we maintain this, again, not just for the Chief Justice, but for every single politician and person with power and privilege that makes such unfounded allegations and pronouncements.
I mean, there's a really interesting conversation, not just here, but in other countries as well, around vaccines. So, I mean, I find this incredible because you and I, and frankly, every single South African, or virtually every single South African of your and my generation, being a bit presumptuous, but your and my generation will have a little mark on the arm from when we were vaccinated. And that vaccination will possibly have saved our lives from measles, mumps, rubella, polio, smallpox, depending on how old you are, protected you from tuberculosis. In some cases, the TB vaccine might even help you against COVID-19. The power of vaccines, frankly, as if it were magic, okay? I completely accept that, and I firmly and strongly believe it, which is a warning to anti-vaxxers that I come across. But you must surely be as concerned as I am at high percentages of people in this country and in other countries. I mean, in France, 47% of people say they wouldn't necessarily take a vaccine. I battle to understand how we got here.
It's a huge concern, Stephen, but what we've always said is that we try and do work with conscience. And we've said that vaccine hesitancy and even anti-vaxxer sentiment has its roots in a historical context. And so we have to understand that we come from a history where medical research has not always been to the benefit of communities, especially communities of color and Black communities. But having said that, South Africa has enacted legal frameworks even from apartheid, which are still in place today, that protect not only participants, but ensure that medicines that get into the public service are safe. One of the ironies we pointed out in our affidavit, of course, was that it's really interesting that, in our press release, is that the Chief Justice is free and healthy and alive, very likely, to make these statements as a result of childhood vaccines that he most likely received when he was a baby in the Northwest. So it's quite something to witness. That a beneficiary of it would be making these statements.
How do we go about changing people's attitudes? I mean, obviously the one thing that would work is if, for example, we see in Britain, which for the moment at least is sort of leading really the world in terms of the number of vaccinations, if it turns out the pandemic ends there, well, I mean, that's the strongest possible case, isn't it? It would be hard to argue with that.
Absolutely. I mean, I think one of the things we have to bear in mind is that we need to urgently, and by we, I mean civil society and in general the country, we need to understand this body called SAPRA. There's an amazing body in this country called SAPRA, and SAPRA are the custodians of making sure that every single medicine we see, including vaccines, are not only safe, do not only work, but are also of high quality. So we need to build the public's faith and trust in this legislated body, a body established by an act to do its job, a job that it has done sterlingly well for many years. And yes, there are concerns around the speed at which vaccines might be approved, but SAPRA does its work and it does its work well, and it is open to scrutiny. But we need to have faith in our regulator, the regulator that has played a key role in making sure that some of the medicines and vaccines that many of us alive today have had the benefit of is responsible for. So we need to know that vaccines don't just arrive in this country out of the blue. There's a stringent, world-class, peer-reviewed mechanism that results in us receiving a medicine or a vaccine in a clinic. And so we need to have faith in public institutions while holding them to account. We certainly are not saying they're all perfect, and we continue as civil society to hold these bodies to account.
Tian Johnson from the African Alliance, I really appreciate the time. Thank you very much indeed. We're lodging a complaint against the Chief Justice Mogoeng Mogoeng for his comments about vaccines, his prayers about vaccines last year. I suspect that is a debate that is going to go on for quite some time. In a way, 2021 may well be defined around vaccines and the rollout.